Antenne shared yesterday and through the rest of this presentation, we are going to identify opportunities for strengthening sectoral coordination in all its forms, and how to respond to the different phases. It's also really important to understand that it may not be possible in some instances in some periods of time to really provide all the range of nutrition programming as we've been doing in the past 3 or 4 months. Some prioritization may need to take place. At the same time, though, it's really important that we strengthen our capacity to reactivate the programming whenever mobility restrictions are lifted, but also it's likely that we are never going to go back to the way it was up to December of last year in some countries, and actually in all countries. And it's really important that we use these the current needs to improve our service delivery in a way that not only prevents the current COVID crisis, but also prevents future face-to-face transmissions and pandemic transmissions. So it's really important that we consider modalities on how we can improve this. Now, for the countries that currently have a humanitarian response plan, there will be coming very soon additional guidance on how to revise these plans to make sure that they remain relevant, and also how they consider the additional needs of COVID response and additional funding that may become available as part of the COVID response. So this guidance will be provided. It will be coming very soon. It's expected very soon. And additional guidance will also be provided for countries which do not currently have a humanitarian response plan, but which may need to scale up their response through the additional global humanitarian response plan for COVID. So stay tuned. In the coming days, we're going to clarify the various opportunities as they are being currently discussed at the global level by OCHA, the Emergency Directors Group, and the COVID situation. I think that's all for me at the moment. So we'll be able to respond to additional questions, and I think it's best to keep good timing. It's best I suggest Antenne to proceed with the presentation, and then we take additional questions if needed at the end. Or please write down additional questions, and if we do not have time to answer them during today's call, we'll make sure that we get back to you on the individual level. Sorry, one point that I forgot that is very important. Sorry, is really that we are planning next week already to have some regional calls with countries from the same region. To make sure that we give more space for individual feedback and clarifications, but also it's important that countries in the same region benefit from feedback from neighboring countries to identify common opportunities and common solutions and lessons learned. And also, I think these regional level discussions will also open the space for more specific support, either from UNICEF or from additional key stakeholders. So over to you, Antenne.
Thank you so much, Stefano. I think I'm sure many of you will have a question on what Stefano talked about. My suggestion is for me and Yara to go through the next slides very quickly, and then we will open up for question and answer, also discussion. probably we'll have 15 to 20 minutes for this discussion. So please take note of the questions or some of the comments you may have, and then we will open up for discussion later on after the next slides. Shabib, can you click on the next slide, please? Okay, the slide is not moving, but I will start by pointing out a couple of documents which we were sharing with you over the last 2 weeks. I think 2 weeks ago or so, we sent global cluster coordination group recommendation for recommended action in country cluster coordination. These are very generic recommendations, which I will go quickly through that. And then afterwards, we also sent our coordination team, Yara, and also Stefano also sent a couple of documents which primarily focus on the nutrition emergency programming. And then yesterday, I shared with you the GNC coordination guidance in the context of COVID. Overall, the whole objective of these documents is to help you adjust the way we do coordination at the country level. Of course, it is flexible. It is a very generic recommendation. It's up to you to adapt it to your specific context. Having said that, I would like to go through these key recommendations from the Global Cluster Coordination Group, which I think are worth implementing in our country cluster sector coordination mechanisms. One important thing which you should know is that the COVID as #1 priority is now included as a standing item in the intercluster or HCT meetings. And also, Yara will talk about it later on. I will also briefly talk about it. Nutrition cluster and other clusters are also recommended, highly recommended to assign a focal person, a point person who will be facilitating, leading the work, the coordination work related to COVID. I will speak about also a task force. Yara will talk about it more in detail. The focal person may be someone really kind of a focal person who facilitates intercluster discussions on COVID. And it's also important to link whatever we do with the national government response plan. Whether it is a preparedness contingency plan, we need to ensure that we are actively engaging with the government effort, because this is, as you might have heard from WHO, this is the whole of the government approach in its very nature. So we need to really align to that approach. And this is definitely a multi-sectoral endeavor, and then we have to ensure that whatever we do continues to be multi-sectoral. It comes very natural for nutrition, but it comes very important at this very moment that we do whatever we do in a more intersectoral way. And the issue of vulnerable people being the topmost priority for the humanitarian actors is something we need to really underscore. And another important issue, which is related to our movement ability to provide trainings and so on, cluster need to really review how the trainings are conducted and then how movements are done within the country. And then, of course, the global coordination group encourages increasing use of technology for the work we do in coordination. So these are very generic recommendations, mostly common sense, but at least we need to keep them as a sort of checklist so that we more or less follow this on a regular basis. And then, of course, the situation dictates, the country context dictates which one of these are most applicable in your context. Moving on, Shabib. As I said, the global coordination group recommendations are more of generic. We have a very specific one. I don't know, you have already seen the coordination guidance, which I shared yesterday. We looked at two scenarios, which are related to the impact of COVID on population mobility. So we have a scenario one, which is no population mobility restrictions, which is okay, or status quo situation. And then we have another scenario, which is a partial or full population mobility restrictions, which have a significant programmatic and coordination implication. And there are, regardless of the two scenarios, there are 3 or 4 important recommendations which I think are important to apply in the context of COVID threat. Number one, every one of our cluster or sectoral coordination need to consider establishing a COVID and nutrition task force or a COVID nutrition technical working group. Yara will talk about the purpose, the key responsibilities, and the composition of the group later on. And then each one of our cluster or sector coordination mechanism need to have a focal point. I already talked about it. There has to be someone who really is a person linking the intersectoral work. It depends on your choice. You may have more people, but at least a person or persons dedicated for the intercluster engagement. And then another one is making use of technical recommendations. We are not yet there, but the GTAM, the UNICEF Program Division, and other UN agencies who are working on nutrition, also other NGOs specializing on different aspects of nutrition emergency, they are issuing different technical recommendations. We are reviewing these technical recommendations carefully through the GTAM mechanism, the technical assistant mechanism. That is a body of technical expertise who review the different technical guidelines which are issued on COVID. So these materials are available online. We have set up a document repository on GNC website. You can access those materials and make sure that those are applied at the country level. It's very important. We are not saying that these are the final documents. Even the documents we shared with you mostly are version 1. There is a reason we said it's version 1, because we are learning and you are learning. We can only provide you the information based on what we know so far. So these documents will keep on updating, but it's important to make use of these resources as much as possible. And then finally, a joint statement on IYCFE. IYCFE may be affected in this context, so it is highly encouraged that the joint statements are issued. We are aware of a number of countries are in the process of doing that. There is a template produced, and we can make use of that as needed. So these are more of a general, whether it is a scenario 1 or scenario 2. But there are certain recommended actions which are very common sense, which I'm sure already most of you have started applying, but for the sake of consistency and for the sake of also aligning those core key actions, which are listed in the first column, these are extracted from the different cluster core functions. So meetings and trainings, they fall under the service delivery aspect of the core function. Here there are very clear recommendations. The recommendation in case where there is no population mobility restriction is replace meetings with as much as possible through virtually, through Skype or any other technology available. No trainings of more than 20 people, and the trainings should have mitigation measures. In terms of scenario 2, as you all know already, there is no need to have a face-to-face meeting. Everything should be done on a conference call. So, and then training should be done 100% online or on a virtual platform. Assessment, as you can see it there, in case of recommended actions for the scenario 1, put mitigation measures, prioritize, explore possibility of collecting data remotely by phone. These are some of the practices which we adapt from assessment experiences in fragile context. In case of scenario 2, cancel all assessments, replace them with secondary data analysis, and if possible, collect data by phone. And coming to the planning and implementing of cluster strategies, this is more of the planning, the programmatic delivery aspect. As I said, stick to the recommended technical guidances. We haven't yet covered all the technical areas, but hopefully we will soon have guidances for all this. For example, we have already issued a wasting program in the context of COVID, which is available on GNC website. We have also issued IYCF and COVID-19 guidance recommendation. So these are examples of technical guidance which would help you to adjust your program planning and delivery. There are a number of issues. I am also seeing some comment from colleagues that how about community surveillance? How about working with the community? I think all these are important questions. I cannot really give like exact answer right now. But the fact is that we need to make sure that whatever we do is compliant with the in-country recommendations. In-country recommendation relating to mitigating or preventing the communication, the spread of COVID, and also on planning and service delivery, on implementation. It is expected, as Stefano mentioned, the HRP will be revised at a country level, mostly in countries which already have HRP and in countries who are covered through the regional refugee response plan. So those countries, it is anticipated that they will be revisiting their HRP, and revision will happen perhaps over the coming weeks or so. Coming to monitoring, is very straightforward. Review the monitoring on-site monitoring modalities and find an alternative way of monitoring because we need to avoid an in-person contact, and as much as possible rely on remote monitoring technology. We cannot prescribe here which technology, but find a way of adapting available technology wherever it is available in your context. Finally, on advocacy, community engagement, accountability, advocacy is very important. We are feeling that nutrition may be sidelined, or maybe under 5 in general may be sidelined from whatever is done for the COVID response. So that's a very dangerous path, and we need to make sure that that doesn't happen in the countries we are coordinating. And it's very important. Perhaps over the coming week or so, we may also give you some tips on drafting advocacy message, and then also the issues on cross-cutting issues are here important. They are applicable and need to be applied in the context of COVID. And then finally, it is very important that whatever the tools which we haven't really adapted, for example, we have a emergency preparedness guidelines and tools. These are still applicable to this context. It doesn't mean that the tools and the guidance we have already at the GNC need to be 100% changed at this time. They can be adapted slightly, but they can, in most cases, they can be used the way they are right now, because they are done for, in general, for any kind of emergency. So make use of examples, the preparedness and contingency planning guideline, and we'll see also if there is need to for modifying that. Next will be Yes,
Hold on a
please.
second. May I make a clarification? Sorry.
Yes, please.
Okay. Couple of points. The 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 establishing the task force or issuing the IYCFE joint statement. It may not be a requirement in every country. It depends. Different countries have got different context. The task force, it depends on the mechanism in place in the country. It is, though, if you consider having difficulties because it's likely that the COVID response is going to require much closer collaboration with the health, WASH, food security, and so on, or intersectoral overall coordination mechanism. If you feel that this is taking a lot of time, then maybe it's worth creating a task force that can take over some of these components and then feed back into the coordination mechanism. Also, the joint statement on infant feeding in emergency. It was recently 3 days ago, we issued a brief that provides a lot of guidance. Now, if you feel that a statement is useful to engage the media, to advocate with governments or with donors, so you find that the messages and the points made in the statement can be useful in your context, then also make sure that they are not confused for the guidance and try to share the statement together with the brief so that it's clear what it is. But again, normally we issue statements when the guidance is outdated and we want to make sure that we accelerate. But since the guidance has been recently updated and it will continue to be updated in the coming days, then also it's really important that to understand how to use the statement. If you have any doubts, our colleagues and Yara who's coming next will be able to clarify on that. Over back to you, Antene.
Thank you, Stefano, for the clarification. Yes, these are just general recommendations. Context dictates very much. So we are just giving you a general recommendation. It's up to you to contextualize it. Thank you so much, Stefano. I guess next we move to Yara, who will quickly take us through the... Am I right? Shabib, I cannot see the next slide. I think it's the slide on the terms of reference and the nutrition emergency guidelines. So, Yara, would you proceed to...
Yes.
Yes, please. Go ahead.
Hi, everyone. Can you hear me? Hello?
Yes, Yara, we can hear you.
Okay, so as Antene was saying, so there is a recommendation to create a task force or a technical working group in your country on COVID-19 and nutrition. Of course, as also Stefano was mentioning, this is really depending on your context. This technical working group is meant to be a subgroup of the nutrition cluster or sector coordination mechanism, with the task to guide the implementation and monitoring of programmatic measures to reduce nutrition-related mortality and morbidity as a result of COVID-19 impact. So basically, what it means is that this subgroup that you will be creating from partners who are attending your meetings is basically a group that will be providing guidance to the rest of the partners on how to adapt already existing and available guidelines, such as the briefs that Antene mentioned, and all the mitigation measures to adapt them to the context. and to be able to guide the implementation of those mitigation measures by all partners of the nutrition sector or cluster. So am I coming out clearly?
Yes, it's clear.
Okay,
Yes.
great. It's very clear.
Yes, yeah,
Yes.
you're very clear.
Thank you. Okay, so I can continue. So the idea of this task force or technical working group is to support the collective nutrition coordination mechanism. So to be up to date on the latest briefs and to be able to adapt the program and to guide all the programmatic and to adapt the programmatic the programmatic service delivery aspect in your country and to guide the rest of the collective. So this is one of the main tasks. Before I go into the other tasks that this group will be working on, is basically ideally the group will have co-chairs, right? So you the ideal is that you share this template TOR that we have put together. We have put together a generic TOR to support you in creating this group. You can share it with your partners and ask who's interested to be part of this group, but also make sure that this group is representative. Of course, this is very context specific. You will have to decide how you go about it and how big or small is this group. But ideally, you would have someone from the MOH, again, depending on your context. And also, if it's possible, someone from UNICEF and other UN agencies, and of course, all the stakeholders that are in your country that are working in nutrition. So ideally, the group will not be very big, so that the work can be done. So from 5 to 10, I would say, even if it's a smaller group, that's totally fine, as long as they can work together to adapt the program with the mitigation measures necessary to avoid the COVID-19 spread and avoid the impact and the related mortality and morbidity that it results. So. Okay, so this group is also meant to work with the other technical groups that are available. So if you have already an IYCFE technical working group, this group is meant to work with them on everything related to mitigating measure in IYCF programming, and also is meant to work with the other group if you have an assessment working group or an acute malnutrition working group or a micronutrient working group. However, in case there are no technical working groups or some of them are not existing, this group is responsible to adapt for all the nutrition and emergency teams, the programs. So this group will be ultimately responsible. This is the idea of this group. Of course, you can customize in your country, but that's the idea. Again, you might need to issue a joint statement, but this is again depending on where you are, on IYCFE in particular. And to help you with that, we have created a template with the IFE core group. So basically, this template is available for you to customize if you see it appropriate. And as Stefano said, it would be good to also join the brief to this joint statement. The idea of this group is also to develop a contingency plan that includes service provision and supply chain management, because there might be a disruption in the supply chain. So basically, some of you will have to develop this contingency plan, but others may have to already start thinking about the operational plan. So this is also a task that this group can be working on, as well as developing and articulating better the community engagement, that the mitigation measures on that level. So maybe you will have to adapt if the community health workers can no longer go to the houses, how you can use other means or what they need to be equipped with, etc. This group can be working on all of these details with the collective. What I also want to talk about is that there are additional tasks for this group, like, for example, to work with the other sectors, specifically the health sector, to also act as focal point. The co-chair can act as the focal point for the cluster on COVID-19 matters. So these are some of the tasks that we also added in the TORs that Antene has shared with all of you. that we have been working on as GNC-CT. And one of the tasks also, is monitoring the implementation of those mitigation measures. So, what I also wanted to say is I want to encourage you to read the TORs. They are also available in French and English. So for the time being in these two languages, if you need them in other languages, we can see what is possible. I want to also just say briefly, I don't know if there's another slide. Shabib, is there another slide for me?
Yes,
right afterward?
Yes.
Okay. Would you please? Okay, great. Yes, I think Anthony touched on that, so I will be very brief. So basically, there are some technical briefs that are already out. Some of them have just been out a few days ago, as Stefano mentioned. So basically, these are what the task force or the technical working group, if you are having one, these are the materials that the working group can use to adapt the program to the context of COVID-19. These technical briefs will be updated every 10 days, and they are issued by UNICEF PD and the Global Technical Assistance Mechanism with GNC collective review. So as Anthony said, the management of child wasting in the context of COVID-19 that you all should have already. The infant and young child feeding in the context of COVID-19, you all should have it also. The template joint statement that was also shared. And there is a GTAM list of resources that is also a new version is going to come out soon. All of these and much more, as well as a repository as well in the GNC website. You can find them all on the GNC website, and please check often to see when they are updated. Okay, I will stop here from my end.
Yeah. Thank you, Yara. Thank you very much. Now I think we have really stick to our time very well. So and nonetheless, we can have 15, maximum 20 minutes if everyone agrees for discussion, and then afterwards I will talk about the coordination support from GNC. So now we will open up for yes, please.
One brief point. I see some people are already leaving, and we are coming up to the hour. Just one brief point is, countries, I see many participants from countries which we do not normally provide support to from the GNC-CT. So any country that either already has a sectoral coordination mechanism or is thinking of developing one or strengthening the current one, please do get in touch with us so that we can include you in our contact list. We can share additional material with you, and also make sure that you also are part of the regional discussions that we are planning for the next week and in the near future. So to make sure that even if you do not have a sector coordination, we can also help you, giving you some guidance on how to set up a sector coordination mechanism. And this doesn't have to be only in terms of COVID. It can be to prevent malnutrition in all its forms, including prevention of overweight and obesity, but also to make sure that sector coordination includes in its mandate preparedness and response to nutrition and emergency, and in particular in the COVID response. So please let us know if you're not part of or if you want additional support. We will be very happy to provide it. Over.
Stefano. Stefano.
Hello.
Yes, this is AA. I just want to make a note on the point that you presented on canceling some of the assessments and use the secondary data where possible. In the context of COVID, yes, but I think we also need to think beyond COVID. God forbid, who knows what kind of illnesses will be coming in the future. So we really have to think ahead on digitizing assessment and building capacity of countries to do digitalized assessment. That cut across different kind of public health emergency, different kind of emergency scenarios. Just to make a note of that, that's all.
Thank you very much, and I hope that you are well and safe in Kabul. One point is that decisions on how to conduct individual surveys or assessments where you are in close contact with the people, it's a decision that really needs to be taken at the country level, in collaboration with the health emergency colleagues and the head of agencies. At the moment, the overall suggestion that we have, and again, this needs to be contextualized and agreed upon at the local level, not from the global level. But at the moment, if I can give the personal recommendation and the GNC recommendation is to hold on to public assessment for the next 2-3 months, because even if there are no reported cases in some countries, it's likely that this number of cases is primarily reflecting the country's capacity to test and report on positive tests. It's likely that every country is now affected by COVID, so when we consider scaling up or conducting surveys or household level assessment where we bring people in, we see several households in large numbers, this decision really needs to be assessed at the country level. But if possible, my suggestion is to seriously think about these measures, and if possible, see if you can base your guide or programming guidance or changes based on existing information. And I mean, assessment and surveys have never stopped us from actually implementing or prioritizing areas or groups before. We have done it even in contexts where there were no service for several years. In Afghanistan, has also been done where there were big gaps in assessment because of security restrictions. So again, this is a question that needs to be answered at the local level, but also do consider that just because there are no reported cases, it doesn't mean that COVID is not already in your communities, and what role our service provision can do to prevent the spreading of both our beneficiaries and our health workers. Over.
Thank you so much. Thank you. Additional question, comments, please go, guys, colleagues, please go ahead. I also see some comments on text. I am capturing those comments, but I will address those questions later on. Who wants to go? Countries, particularly identifying challenges you are facing and the key asks and support needs from the GNC.
Okay, Antony, can I say something?
Yes, please. Said, go ahead, please.
Okay, Antony, there is one thing which I have already written on the chat box as well. That is about the vitamin A supplementation. This may not be really our nutrition priority as a nutrition cluster, but we are observing the trends that since in countries where the vitamin A supplementation is suspended, there you would have measles outbreaks, and they might come up into emergency 1. Secondly, I would also like to stress upon GNC to again consider reissuing a guidance of providing, as you already said, providing the PPE kits or PPE equipment to the frontline workers, because this is one trend that we are seeing in the countries where the frontline worker, particularly who are responsible for the community outreach work, they are not being provided with the PPE kits and they are reluctant to go in, and this is why follow-ups and the services are being disrupted over there. Thank you.
Thank you. Said, I will take note of your comments, and then we'll afterwards, Stefano and colleagues will respond to that. Any other, please?
Hi, Antenna.
Yes, that's Tariq. Yeah, go ahead.
No,
Yeah.
thank you for the enlightening presentation. One comment from my side is we need also to think about mothers, because we know that the children, as the evidence is showing, they are not affected by or severely affected by COVID-19, but their caregivers are, and they can act as a source of infection. And in a situation where you have high maternal malnutrition, then this will increase their risk as well. So, and this is why also we need some sort of guidance and focus on how we can strengthen the maternal nutrition in order to boost their immunities, and also encourage optimal infant feeding practices. Over.
Thank you, Tariq. Let's take note of the comments, and then we'll respond. And one more, please.
Antene, this is Isaac. Good afternoon from Sana.
Good afternoon, Isaac. Go ahead.
I also want to join the rest of the colleagues to appreciate this brief and the guidance which has been provided by the GNC. I just have one comment related to the task force. I think I'm happy that the guidance which have been discussed today are very useful, because in our case, for example, we had actually started such kind of
Isaac, I can't hear you. Hello, Isaac. I can't hear you. I don't know whether it's from my side or your side, but I can't hear you. Go.
Can you hear me now?
Yes, I now hear you loud and clear.
Sorry. So what I was saying, that first of all, I want to join the rest of colleagues to congratulate you guys. I appreciate your support
we heard
in terms
that.
of coming up. Yeah, okay,
We
you
heard
heard that.
Thank
Good,
you. Yeah.
Okay,
Thanks.
good. Sorry. You didn't tell me when. Now, the point I wanted to make is that I think just to reflect that the guidance you have provided in terms of establishing the task force, I think is very useful, because in our case we had started as a group working on this, but we didn't have this kind of formal kind of guidance in terms of what are the activities or the work the task force need to be doing. So I think it's just to say that they are useful, and I think it will improve maybe the coordination of nutrition activities in the SANA. We don't have a case for the time being, but I think we are still working on the preparation, on the preparedness phase. And the last point, which I think I had already hinted, Yara in a separate discussion, is very much linked with Stefano's comment in terms of the joint statement, because it's good also to have an understanding in terms of which context this joint statement can be provided. In a country like Yemen, currently we don't have a single case, and so a kind of guidance in terms of which context this kind of joint statement can be provided may also be very useful. Over to you. Thank you very much.
Thank you so much. Let us address these points made by colleagues. And there was one point regarding vitamin and measles, how we can avoid the risk. And then Said also raised a question about PPE for frontline workers, and then Tariq about mothers and caregivers. Stefano or Yara, would you like to respond to this?
Yeah, I can answer a couple of points. Yes, of course, there is no clear solution. Okay, this is a major crisis. It's going to affect our capacity to deliver nutrition services. There may, at some times, there may need to be a prioritization process of which services we are able to do in a way that protects the people working, our collaborators in the field, and also that brings in the best public health impact in terms of nutrition, but also making sure that we are not actually contributing to increasing the spread of the virus. So these are difficult questions. We do not pretend at all to have answers that may be suitable to every country. We are happy to provide though additional support and discussions on specific cases, but this needs to be part of the wider discussions on COVID response at the national level. So a lot of this needs to be done. Mothers for screening, absolutely. It can be useful in many areas, and it needs to be considered though how then you collect the information back from mothers and how that information is used. But surely that's an option to be considered. Maternal nutrition, of course, the current guidance that the briefs that have already been issued do not adequately consider maternal nutrition. We will make sure that the next one also takes consideration of that, and also really any guidance, any material that we are sharing at the moment may also be subject to modifications as we learn more about the various challenges and the opportunities, and as we learn more from all your work in the country's level. So we will adapt, and the material is already developed, and within the next few days we are going to have the new GNC website launched, which is going to provide a clear platform for all these COVID-related material and additional material available, and also which is going to be benefit obviously from the contribution in terms of technical advice from the GTAM, which is the one-stop platform for technical advice, and which at the moment will be hosted by the GNC website, but is going to have its own website in the next couple of months. So please hold. Additional material will be available, and additional support. We're going to find ways to reach out to you for specific issues. Anyone else?
Thank you, Stefano. Unless Yara wants to add any point.
No, that's Stefano covered everything.
Okay, thank you. I was also taking note of some of the text message you were sending. There was a recommendation for having all the materials in French translation. We'll do that as much as possible. The coordination guidance, our colleagues translated it, and it will be ready for you in French as well. There was also a question, or rather a recommendation raised by regarding the monitoring indicators for implementation of MAM in the new adjusted way. I mean, there is a bit change in modality of delivery of MAM. How do the indicators would change? There was a question raised regarding that. And then also Jacinta raised a recommendation regarding the need for revision of guidance on the revision of the COVID HRP. That's well noted. Tariq raised about how to handle community surveillance in a COVID situation. That's also well noted. And Syria and also Afghanistan, Syria, Najwa mentioned that they have a task force already. In Afghanistan, they are using the SAG as a task force, and whether that's the best way or not, I think it's difficult for me to comment right now. But as much as possible, we really want a very dedicated task force or working group, but we can discuss that bilaterally. So these are the points I managed to capture from the text, and mostly these questions are, I think, technical in nature and would require a technical response. So perhaps when I go to the last agenda item, which is what GNC support can be provided in the context of COVID or in general, I will speak to that very briefly in the next, after maybe a few minutes. I think, to be fair to some colleagues outside MENA or the usual regions, I would like to open for colleagues from far away. By far away, I'm referring to Lacro, if anyone is from Lacro, or I saw someone also joining from Philippines. I would like to give opportunity for making your points from sector coordination countries, if you can also, if you have any points to raise. Hello? If not, then anyone can, if you have any points you want to raise, please go ahead. Any region.
Anthony, this is Yara. I just want to
Yes.
say one small comment. I want to say that I am collating all technical questions and I'm raising them for the revision of the briefs. So if you also, I want to just invite anyone who has a technical question, a question related to the briefs, and they want to see something in the brief or a guidance such as community surveillance or others, they can write me and I can collate and raise that to those who are updating them.
Okay.
Thank you.
Anton,
thank you, sir. Yes, Alam, go ahead.
Thank you, Anton, and thank you, Stefano, for the presentation and enlightening us with the global response and the situation evolving. I have two concerns. One is I mentioned it in my notes as well, and this is very pertinent to the countries having the HRP response ongoing. We have 6.2 million, including 3.2 million children under 5, receiving assistance through the humanitarian response plan. We may see, because of the wider pandemic response, we may see a deviation of resources from the ongoing HRP and humanitarian responses. And Stefano rightly mentioned that we may have a problem with advocacy towards the children in particular, because COVID is not that much affected. Luckily, it's not that much impacting on the children. But if the vulnerabilities are there and we don't reach these children, they will have likely an impact of the other diseases which are, and this is what we learned from the Ebola response. When the humanitarian were paying attention to the Ebola, the other routine programs were sidetracked and sidelined. And at 6 months down the road, we were having implications more on the routine programs rather than the Ebola itself. The mortality and morbidity because of the routine programs were higher than the Ebola. So that's the difficult situation, but we may have to continue our advocacy that the continuation of the routine humanitarian response programming is critical in this situation as well, because we are reaching out to the most vulnerable through our assistance, programmatic assistance. The second thing, thanks for the guidance which was shared by the GTAM and the colleagues from the GNC, but probably a continued effort would be required in terms of the community outreach, how you manage the mother support groups and the community sessions of IYCF, and the mass screening campaigns which we do in the malnutrition and the distribution programs. Probably we may have to focus and how to protect the frontline workers in terms of the not spreading the transmission and keeping themselves safe as well. So this is more evolving situation, and it's a difficult time for us to respond to, but I hope everyone is staying safe, and we look forward to working with you and seeking guidance from you. That's all.
Thank you, Allah. If I may say just a point regarding your concern about diversion of resources from the ongoing HRP or ongoing nutrition emergency response. I think it is a very important point. what I can see from the global humanitarian response plan revision, it has clearly underscored the fact that there shouldn't be any diversion of resources. The existing response should continue, but it at the same time mentioned that there is maybe a need for reprioritizing, scaling up or scaling down. So more detail is there, and when the country level guidance comes, or country level guidance or revision of HRP comes, I think there will be more clarification. But in any case, we need to keep on advocating that the nutrition emergency services should be continued at least where they are, or if possible to be scaled up. In any case, they shouldn't be affected negatively by the ongoing situation or by the diversion of resources. Stefano, would you like to?
Yeah, just one more point. The same applies to Sudan. As at the moment, you're saying that there is an understanding that children are not necessarily affected by COVID. We are issuing, I'm waiting for a final, we've already agreed on a joint statement on prioritization of children with wasting as at-risk group for COVID complications. So if that's the case, a lot of children in Sudan may actually be at high risk of not only of COVID infection, but of COVID complications. And the capacity of the health system to support those complications is likely to be very limited. And as Anten also mentioned, the HRPs are going to be subject to revision, but this revision is, of course, if in your HRP you put down resources for a large meeting and the meeting doesn't take place, obviously that resources can be used in a different way, but or capacity building, which at the moment we should probably thinking about scaling down our face-to-face capacity building or trainings or meetings. But otherwise, the additional needs for COVID should be covered by the global HRP for COVID, not from the existing one. So the revision will include some changes, but any additional needs should be covered from additional sources of funding. And you will be provided additional specific support as we learn more about it. We will share it with you. Over.
Thank you, Stefano. I think.
Hello.
Who is that? Who is coming in?
Anne-Marie is speaking from AD.
Okay, go ahead, Anne-Marie, please.
Yes, I would like to thank you first for giving us all this opportunity to learn more about these issues around. And I have a country-specific issues. I want to ask Stefano if I can contact him bilaterally.
Possible, I guess.
Of course, Anne-Marie, I'll be very happy to speak to you. Send my regards to Dr. Maron, and yes. I really hope that we can. I know that you already have an ongoing sector coordination mechanism, but maybe this mechanism, this group can be benefiting from additional specific support. So very happy to have a call with my team and myself and see how best we can support sector coordination in Haiti.
Thank you. Thank you, colleagues. I think we really spent like almost 20 minutes, more than what was planned. I took note of the comments you made on the chat. We take note of that, and also a number of points you raised is well noted, mostly technical. we will continue to follow up on that. But also, I would like to take this opportunity to clarify. Not everyone really understands how the GNC supports countries, and sometimes countries are not proactive in reaching out to colleagues. Can you mute your speakers, please? It's causing a lot of noise. Okay, now it should be okay. So I wanted to take you through very briefly how you can get support, whether, of course, now is COVID is a top priority, and also beyond COVID. And not everyone really knows how the GNC provides support, what kind of supports exist, and what are the options available. So in general, the GNC has 3 mechanisms of providing support to countries through remote support, in-country support, and capacity development. The remote support is basically support through the help desks. We have 6 areas which we cover through help desk. Shabib, can you? Yeah. So you can see the names of the focal persons. David is covering coordination, Danka intercluster, Victoria is covering nutrition information system, Shabib is, as usual, supporting information management, Yara deals with nutrition emergency, and Andre is a person responsible for cash-related assistance. So these persons are available for a call during any time of the week. And sometimes also they organize technical webinars, and you can benefit from their support. So you can directly contact our colleagues, and they can provide you a remote support on the different technical areas mentioned here. The other support we provide is in-country support. This in-country support, we may not be 100% relying on this approach this time, because deployment has become difficult, at least for now. The in-country deployment in a normal case is done through, we have a rapid response team deployment. I am the focal person. We have 2 cluster coordinators, including me. And then we have 2 information managements who are available for deployment. Of course, the COVID situation is a different scenario, but normally we are available for deployment. And then we have standby partner staff. These are partners who provide a human resource on coordination and information management for deployment. And we have a standby focal person, and your country offices can reach out directly to Lauren, who is the lead person on that. We have also technical rapid response team, which is a group of NGOs, IMC there, and Save the Children, and others, who provide human resource expertise on key nutrition emergency technical areas. So they are available. Of course, there is always prioritization on the criticality of the need for the request for deployment. And then we have the global technical assistant mechanism. Among other things, the global technical assistant mechanism has a roster of technical individuals in different nutrition emergency specialties. And there is a GTAM roster email where you can reach out and then ask for, if you need a specific expertise on a specific nutrition emergency technical area, you can also get that support. And then finally, the UNICEF internal search and stretch assignment. This applies, by the way, to within country deployments. There are times where we deployed from one part of the country to the other, so you can also explore the possibility of using the UNICEF support. So all these are the different supports we can provide in collaboration with different partners. And then finally, capacity development, which is trainings, mentoring program. I'm sure you know the mentoring program, which has been running now. The 3rd round is running. There are a list of contact persons. Danka is the contact person for nutrition cluster, inter-cluster coordination. There is a typo mistake there. It should have been inter-cluster or integration training, the way we call it. Danka is responsible for that, but for the rest of the trainings and the mentoring program, I'm the focal person. So you have option of having remote support 24, not 24/7, of course, 5 days a week during working hours, and then we have in-country support, and then we have capacity development. And then on top of that, our website is available to provide guidance, tools, and different materials, including online learning opportunities. So I would like to stop here, and finally I would like really to say that because of the COVID situation, our mode of support, the modality of support, as you can imagine, has been affected. But as much as possible, we try to enhance and intensify our remote support. So please make use of that support, and we are available to provide you the support, and feel free to be in touch with us. And I will stop here unless Stefan or Yara have final points.
No, that's all. Thank you very much. And again, we are gonna continue to have more frequent discussions as guidance become available, and we are going to be very happy to provide specific one-on-one support to your sector or cluster coordination mechanism. Thank you very much. Over.
Thank you so much. Thank you. Stay safe. Bye bye.
Thank you. Thank you, everyone.
Thank you. Bye.
Thank you.